Welcome back to the show. September is National Falls Prevention Awareness Month, and this week is Fall Prevention's Week. Falls are the leading cause of death by injury for adults 65 and older, and the CDC reports 25% of all older adults have suffered from a fall. Joining me now and sharing more details is the Associate Director of Rehab Services at VNS Health, Allison Simms. And Allison, good to have you. And as we start this off, I want to talk a little bit about this because this is a pretty alarming number, and it's something that people pretty much should be very aware of.
Yes, thanks, Darren. It is a very serious issue in regards to falls and the number of people who fall within the community.
And when we talk about people falling within the community, these are the numbers that we do have, but we do know that there are a lot of people who don't even actually report falls.
That's correct. That's a very true statement, Darren. A lot of patients, a lot of people in the community, they fall and they don't even realize a fall. The true definition of a fall is an unintentional change in position. When you really think about that definition, you can imagine a lot of people are falling, especially in the home.
Yeah. And so let's talk about the home for a minute, because that's the place where traditionally a lot of people do have their injuries. And what are some of the things that people can do to really prevent themselves from being in a position right around home where we know this happens?
Well, there's a lot of things we can do in the home. The first step is you have an adequate lighting. It's very important that if you're walking within a pathway of your home, just put the lights on. Many times, especially in our senior citizen population, they always feel like they're economizing on resources, so they tend to keep the light off. But it's important that you should keep your lights on so the area is well illuminated and you can see where you're going. Another great step is proper footwear. Culturally, some people don't like to wear shoes in their home, but you should have, if that is the case, you should have slippers or a closed confined shoe that you have just for wearing inside the home. Because when you have that good grip under your feet, it really will help to make you safe. Another tip is cords, extension cords. Make sure that they're secured along a nice pathway on the walls. Don't have them just laid out, because that's a potential for a fall. And another item is throw rugs. Sometimes we have throw rugs throughout the home, but if you have it securely laid down on the floor by using the double-sided tapes, that will help to ensure that the throw rug is securely placed on the floor, and that can avoid you from falling as well.
So when a family experiences a fall and they see a loved one that's had that experience, what is the proper procedure? Because a lot of times people say, oh, it's no big thing. But the reality is it can be a big thing. So what does the family do when somebody does have a fall?
Yes, that's a great question, Darren. So falls are serious, lead to very detrimental situations. So in the event that you have a fall, the first thing you should always do is to check to ensure that, am I okay? You should look around, do a quick body check to see if you have any lacerations, any scratches. Many times these injuries may appear, but it may take 24 hours where you'll start to see the bruising. In the event that occurs, you should always consult with your physician when you had a fall so we can rule out all of these situations, especially if you're on some medications where, for instance, a blood thinner, and you have a fall, you can really be susceptible to internal bleeding. So it's very, very important that you consult your physician and have a consultation and discuss the event that took place in the home.
And sometimes with families, we know that an individual can fall, but that person can be living by themselves. And, that's emotional all by itself. Give us a little bit about the emotional component. How do we encourage our loved ones emotionally, particularly when there's that distance and that isolation? Particularly, we know a lot with COVID-19 that isolation has been huge. So what do I do to help my family member out or my loved one out if they're struggling emotionally?
That's another great question. So the pandemic didn't help us at all. It definitely exacerbated the issue of isolation. But what a fall can occur is a vicious cycle, because when you fall, that individual may be fearful of having a potential fall. So in that event, they don't want to move. but the key to life is movement. And if you don't move, then your daily activities, your daily routine can actually diminish. What are daily routines? The ability to brush your teeth, the ability to go to the bathroom, to perform your personal care, the ability to put on your clothes, dress yourself, put on your socks. The daily tasks that we actually do, we take it for granted. It becomes compromised after a fall. So you have that decreased motion, decreased daily activity, and the psychological component actually worsens, where you become even more fearful of falling. And this vicious cycle, we have to break it. But the only way of breaking it is by encouraging that patient or person in the home to move.
Are there support services that are available for families who may be having, these loved ones who are individual and they really don't know how to really check in and do these things emotionally and or get them the support that they need?
Yes, there's lots of resources in the community that can assist many people with this type of assistance. Some people actually need therapy, and it could be occupational therapy, it could be physical therapy that can assist these individuals. And also, just from a wellness perspective, it's really important that everyone adapts to a wellness program. And that wellness program can consist of just daily routine movements, and that movements can be outdoor walking, it can be done indoors. The whole idea is to keep you moving so we can maintain our optimal functional mobility.
You mentioned two things, occupational therapy and physical therapy. There is a difference between the two, but can you break down for our viewers what's the difference between occupational therapy and physical therapy?
Oh, yeah, there's a huge difference. So, physical therapy is they mainly work on gross motor skills. What is gross motor skills? It's working those large muscles, it's the daily walking, it's the ability to transfer, it's our balance, it's the ability to stay in an upright position and not to lose your balance. I like to focus on physical therapy as the ability to retrain those large muscle groups in your body. Now, occupational therapy is where you focus on your personal ADLs, so activities of daily living. And that's the dressing, the grooming, the cooking, the ability to toilet and bathe yourself. So, and also occupational therapy is those fine motor skills. What are fine motor skills? The ability to tie your shoelaces, the ability to button your shirt, even the ability to comb your hair. It's those fine muscles in our bodies that help us to complete those tasks.
Yeah. And so, for people who want more information, what do they do to get it if they have got a loved one, or maybe they know somebody directly themselves that they've been in contact with?
So visiting the VNS Health, I'm sorry, we were formerly known as the Visiting Nurse Service of New York. We are now known as the VNS Health. We can actually provide physical therapy and occupational therapy services for those individuals that are in need. In the event that there is an interest, they should call the 1-800 number, which is 1-800-675-0391, and also ask your doctor for a referral for VNS Health Services.
Yeah. And talking about movement, that's very huge, right? Because sometimes those falls happen because people are not moving around the house. I mean, they stay in the house, they're not really too active. What are some of the things that people can do to keep mobility and prevent themselves from being dormant and at the same time putting themselves in a position where they can receive falls?
So Falls Prevention Awareness Week is actually in the fall, and which is a great segue for us to introduce us to the new season of autumn. I like to use the acronym that leaves fall and not people. So what can you do to prevent falls? Is just move. That simple walk in the morning, I always say 20 to 30 minutes of physical activity is very, very crucial and important. So that walk in the morning, you may want to go garden. And if you're not able to go outdoors, stay indoors in a seated position. Just move your arms and move your legs. Movement is the key to life, and that will help to prevent you from falling.
Yeah. And once again, let's get the information out there if somebody wants to get it. One more time for the people.
So one more time, thank you, Darren. And if you are interested in VNS Health Services, the number you should call is 1-800-675-0391. But please remember, consult your doctor in regards to the services that you may need.
Allison Simms, we're going to leave it there, but thank you so much for this very critical information. We're talking about Falls Prevention Week. Allison is the Associate Director of Rehab Services at VNS Health, and thank you, Allison. And if we want more information, again, we gave the number a couple times. We'll give it one more time. That number again is 1-800-675-0391. And if you want to go to their website, please go to vnshealth.org. Well, we thank Allison for joining us. And listen, we got more show. Don't go anywhere. Open continues right after this.